Hello, this is Dr. Chris Welsh, board-certified OBGYN with Women's Health Media. Today I'd like to discuss with you 10 facts about nausea in pregnancy. Remember, this video is for informational purposes only and is not personal medical advice. It's just a starting point for you to discuss with your healthcare provider your particular conditions and concerns. Fact number 1. Nausea is very common, affecting 50 to 80% of all pregnancies. Although called morning sickness, it can actually happen at any time during the day. It's the second most common cause for hospitalization in pregnancy. Fact number 2. Nausea that's pregnancy-related usually begins before the 9th week and is fully resolved by 16 to 20 weeks. However, up to 5% of patients can have nausea all through their pregnancy. Fact number 3. Nausea and vomiting in pregnancy is more common in women with multiple gestation, twins or triplets or more, or certain types of atypical pregnancies. It's also more common in women having their first baby, younger women, or women who carry female babies. A history of motion sickness, migraine headaches, or nausea and vomiting in a previous pregnancy also increases the risk. And interestingly, women who smoke have a lower risk of nausea and vomiting in pregnancy, but this is not a reason to start smoking. Fact number 4. For some patients, early treatment of nausea and vomiting, even before the onset of symptoms, can help to prevent a more serious condition called hyperemesis gravidarum. It's very important that a pregnant woman not get dehydrated, develop vitamin deficiencies, or begin to lose weight from her nausea and vomiting. These are concerns to discuss with your doctor. Some reasons to call your doctor immediately are if you're dizzy when you stand, have a rapid heartbeat, notice that you're not urinating as much or your urine is dark in color, have abdominal or pelvic cramping or pain, or have not been able to keep anything down in 12 hours or more. Fact number 5. Not all nausea and vomiting in pregnancy is related to pregnancy. Other common causes that occur in non-pregnant women include problems related to the gastrointestinal tract, the stomach, the gallbladder, or the appendix, problems with the urinary tract, or metabolic or neurologic disorders. Fact number 6. There are some lifestyle modifications that can be helpful to decrease nausea and vomiting in pregnancy. One is to begin a prenatal vitamin at least 1 month before conceiving. Also, if the prenatal vitamin makes you sick to your stomach, you can take folic acid only and not the entire prenatal vitamin. Avoid things that provoke symptoms like odors, heat, light, or moisture. Brushing your teeth frequently or rinsing out your mouth can also help with nausea. Smelling fresh lemon, mint, or orange, or using an oil diffuser with these scents can be helpful. Also, it's important to avoid lying down immediately after eating. Although we talk about the brat diet, bananas, rice, applesauce, tea, and toast, meals that are heavy in proteins like lean fishes or meats or chickens, seeds and nuts, cheeses, and yogurts can also be helpful with nausea in pregnancy. Some women will feel better eating things that are salty, low in sugar, bland, or dry, like crackers, cereal, or toast. And fluids are better tolerated if cold, clear, and sour, like ginger ale or lemonade. Fact number 7. There are some things that can be taken over the counter to help with nausea in pregnancy. Things like ginger, which can be taken 250 milligrams 4 times a day, or vitamin B6, which can be taken 25 milligrams 4 times a day. You can also try the acupressure bands, the ones that stimulate the P6 root on your wrist, like people use when they take cruises, although there's no clear data to suggest that acupressure, acupuncture, or nerve stimulation actually helps. There are also medications available over the counter without a prescription. Things like diphenhydramine, which is Benadryl, dimenhydrinate, which is Dramamine, or doxylamine, which is Unisom. Remember that these are still medications, even though available over the counter, so you should discuss with your healthcare provider the correct dosage and frequency for your circumstances. Now, marijuana is also available some places over the counter, but it's recommended you avoid this or cannabinoid products like CBD oil because of concerns about the effects to the baby. Fact number 8. There are also medications available by prescription from your healthcare provider. The most common of these are promethazine or Phenergan, prochlorperazine or Compazine, metoclopramide or Reglan, and ondansetron or Zofran. They can be prescribed as pills, orally dissolving tablets, patches, suppositories, or given by shot or IV. Fact number 9. Do not combine therapies without discussing with your healthcare provider. Some of these can have interactions that are very serious, even fatal. Never take things at dosages higher than or frequencies greater than what's recommended by your doctor or midwife. Fact number 10. Although nausea is a really unpleasant sensation and nobody enjoys vomiting, If your doctor has ruled out other causes, then often it's just the sign of a healthy pregnancy. There's no association with birth defects, and studies show that women who have nausea and vomiting in pregnancy actually have better pregnancy outcomes. So that's 10 quick facts about nausea and vomiting in pregnancy. Hope they were helpful. Don't forget to talk about any of your conditions or concerns with your healthcare provider. Please see our other videos on Women's Health Media, and thanks so much for watching.